Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. Your child's vision is probably not something new parents think about, but the truth is they really should. The fact is that children can have vision problems diagnosed as early as 6 months of age. Here to talk about why eye exams at an early age are so important is Dr. Raghu, an optometrist and owner of the Eye Center at Jackson. Thank you for joining us today.
Thank you for having me today.
6 months of age is when children should have their eyes tested?
Yeah, it sounds unusual, doesn't it?
That's pretty early.
Especially as a parent, you're thinking about other things at that time of the age.
Right.
You're thinking about diapers and sleeping and things like that, but the reality is if you don't get the examination early in life, if you have an eye turn or an eye problem, it's much harder to fix down the road.
You know, I have to tell you a really funny story, and my oldest son is going to kill me for saying this, but he had a really flat bridge on his nose. And he looked like he was cross-eyed when he was born. And we took him to the eye doctor at a really early age and said, oh my God, is my child cross-eyed? He said, no, it has to do with the bridge. But it was in an early age that we took him and we had him tested.
We see that quite often, yeah.
Do you really?
Happen, yeah.
So but why so early? Are we looking for congenital problems?
Yeah.
Birth defect type things?
Yeah, congenital problems, things that can run in the family as well. Maybe the family history of diabetes or cholesterol or hypertensive issues, or maybe there's an eye disease problem or a high prescription in your glasses perhaps.
I see.
Again, but the key is really the lazy eye. And that's when you have a prescription that's high in one eye more than the other, or you have a small little subtle eye turn. You have to detect that early, treat that early, so that the child's not impaired through their school years.
Now, don't pediatricians typically check children's eyes when they go in for their exams?
Yeah, I think the pediatrician does a good job of doing a gross assessment of the eye. You know, when they're first born, they check for any kind of obstruction inside the eye. Later on through the school years, they will do the vision check on this in their offices, but it's not the same thing as having an eye specialist check their eyes.
All right, so at 6 months of age, you should take your child to an eye specialist. Can you tell us what's going on here? We've got video. What are we looking at here?
Yeah, here the optometrist there is checking the front part of the eye, just making sure it's healthy. Here he is checking to make sure there's no problems with the alignment. If there's a subtle misalignment of the eye, then you won't see well. This is how you actually check for glasses, which is amazing because sometimes that testing can be more accurate than the tests we do on adults sometimes.
Really?
Yeah.
Right. And here's just a really cute baby. But you know, let's talk a little bit. What are some of the more common vision problems that we see in children?
Well, of course, there's the nearsightedness, where you can only see well near, you can't see far away. Then you have the farsightedness and astigmatism. But also there's a lot of eye turns. There's also lazy eyes. There's problems with tracking system, focusing muscle, motility, and of course the eye diseases. So you really want to have a comprehensive eye exam at an early age to make sure none of those things are present.
So if you've got a lazy eye, what's the correction?
It depends on what's causing lazy eye. In the old days, we used to do patching. You might have seen kids that had a patch, but nowadays we can use special drops that can alleviate that. Sometimes there's surgical intervention that's needed. So it really depends on what's causing the lazy eye.
Now, let me ask you this question, and you're an optometrist.
Yes.
Should we take our children at 6 months of age to an optometrist or an ophthalmologist? An optometrist, what's the difference between the two?
They're very similar. The key, though, is the optometrist is the one that does your comprehensive eye examinations and the treatment of eye diseases. The ophthalmologist treats all the eye diseases, but their concentration is really more with surgery. To us, it doesn't matter who you go. It's important to get your child examined at the early age, and if the ophthalmologist or optometrist can provide those services, that's what's paramount.
All right, and what about eyeglasses? I have seen some pretty young ones with glasses on. When is it? I mean, how do you decide that the child needs glasses?
You know, when they're so young, you want to make sure that they're feeling comfortable with the glasses on. And so if you get the glasses too early, sometimes they'll just pull it right off and they won't use it properly. So it's actually more of a last resort to get glasses at such an early age. But if they have a lazy eye, you need that correction to make sure the eye is being used properly. And
the other thing is, you recommend an exam at 6 months.
Yep.
And then, do you wait till 2 years of age, or is there something in between also?
Well, 6 months should be the first, 2 years should be the second, and the 2 years is actually even more critical because after the age of 2, if you do have a problem within your eye, it's very hard to correct after that point.
So that period between 6 months and 2 years is an important piece.
Correct.
Because at 2 years it's fixed, The eye issues are there? I mean,
if there's
real
been
quick.
a problem that's been there for 2 years, it makes it very difficult after that point to try and go back and fix it.
I see. Thank you for the great information.
Oh, it's a pleasure.
Thank you
for
very
having
much
me.
for joining us. Still to come.